Hello, welcome everyone to this channel. My name is Nurse Pam. I'm a registered nurse anesthetist and a medical educator. Today, we'll be discussing a very important but confusing concept in anesthesia drug administration. Blood gas versus lipid gas partition coefficient. Today, I will make this topic in a way that it will be very simple to remember and to recall. So if this is your first time of viewing this channel, I will encourage you to subscribe for more interesting videos. Have you ever wondered why some anesthetic agents work faster while others work slowly? The simplest secret to that is what is known as partition coefficient. Before we go into details of what blood and lipid coefficient means, let us understand the word partition coefficient. It simply means how a drug is distributed between two substances at equilibrium. In simple words, if a gas prefers the blood, it dissolves the, and if an inhalational agent prefers to remain in gaseous phase, it stays in the alveoli till an equilibrium has been established. That's it. So, the blood gas partition coefficient, it kind of determines the onset and recovery from inhalational anesthetic drugs. So the higher the blood gas solubility, the slower the onset of anesthesia and the slower the recovery. I will explain this in detail furthermore. The lower the blood gas solubility, the faster the onset and the faster the recovery from anesthesia. So using this picture here, we tend to see that the low blood gas solubility aspect has to do with if you notice, you see that the lower blood gas solubility, because of this low blood gas solubility, the inhalational drug is not easily absorbed by the blood, so it tends to accumulate faster in the alveoli, and an equilibrium is quickly established, so that within a short period of time it is distributed to the tissues, especially the brain. That's why you see they are less likely to be taken into the blood because they have a lower solubility. But one important thing is that they are more likely to be taken into the brain. While for high blood gas solubility, they are kind of absorbed faster into the blood, so an equilibrium takes a longer period of time to form. So because of that, the rate of induction is slower and rate of recovery is slower too. So because of this, blood gases that have a lower solubility are not absorbed faster by the blood, while those that have a high blood gas solubility, the blood tends to absorb them like a sponge, and it takes this time for this inhalational anesthetic to form an equilibrium. For example, halothane. Halothane have a high solubility, so induction is slower and recovery is slower. While desflurane and nitrous oxide have faster induction and faster recovery because of the poor gas solubility. So for lipid gas partition coefficient is more concerned with potency of the drug rather than the onset and recovery. So the higher the lipid gas, the higher the potency. The lower the lipid gas, the lower the potency of the inhalational anesthetic drug. So why does it matter? First, it determines the potency of the drug, and it usually influences the duration. Why? Because these drugs are stored in fat stores, in fat tissues of the body. So it takes time for them to be eliminated out, especially when surgery lasts for several hours. During a long hour surgery, these drugs are redistributed to tissues, especially fatty tissues. So it takes time for them to be eliminated out of the body. So there's a diagram here that tends to differentiate between the high solubility drugs and the low solubility drugs. So the drugs, inhalational drugs that have high solubility, they tend to have slow induction and recovery. Okay, then those that have low solubility tend to have a rapid induction and rapid recovery. This point help us to understand that blood gas solubility is more concerned with the rate of induction and recovery from anesthetic agent. So to wrap it up, blood gas solubility coefficient is more concerned with the speed or onset of drug and the recovery, while lipid gas is more concerned with the potency of the inhalational anesthetic drug. I want to thank you for your patience and for listening to this discussion on blood gas partition coefficient. If this discussion has been impactful, I will encourage you to click on the subscription button and the like button. And if you would love me to drop another lecture note on minimal alveolar concentration and stages of anesthesia, please do well to send me a comment. I'll be waiting for your comments. Thank you very much.